The Omicron variant is on many people's minds, and with friends and family gathering for celebrations, you might be asking, all right, how concerned do we really need to be? In today's To Your Wellbeing, we are talking everything you need to know going into the holidays. Cone Health's Infection Prevention Medical Director, Dr. Cynthia Snyder, is joining us. First, let's just kind of go over Omicron. Is it in the triad? Do we know that?
So we do believe that it's here, although we haven't had confirmation of like what percentage of the tests are positive.
Okay, it'll be interesting to hear like when that may happen, when we might be able to get some of those tests back to talk about that. So in the meantime, how contagious is it compared to the Delta variant?
So it is much more contagious than the Delta variant. We think of it as like being 3 times as much. And what's interesting is that it does have very high replication in the upper airways, so 70 times as much. And so we know that people are showing up with symptoms like shortly after they're being exposed. And most people are showing up like 2 to 3 days after being exposed from the Omicron variant.
Okay, so this is a shorter window. Before it used to be almost a 2-week window. Now we're down to like a 3-day window possibly where the symptoms could show up. And what kind of symptoms, and are they as severe?
Yeah, so the symptoms are similar, right? So still you're having nasal congestion, cough, malaise, right? Feeling under the weather. And the key thing is that we really impress on people to get tested. And so it is showing up faster. We suspect that it's based on studies in Europe and also some of the information from Africa. It doesn't seem to be as severe, so less likely to be hospitalized. And if you're vaccinated, also probably not having as severe symptoms in a shorter duration. But what's interesting is that the information from Europe is that quite a few people who've been vaccinated are having breakthrough cases, are getting infected, but the people who seem to be protected are those who've gotten the booster. So it's very important to still get out there and get your booster if you haven't gotten it yet.
And do it before the family arrives. Don't wait till after the family arrives, kind of thing. All right. So with it being in a number of states in the U.S., how does that impact the risk if we do gather with people from out of town?
Okay, that's a really great question. We know that it's in I think it's like almost all 50 states, like 46 states have identified it, and it replicates for really quickly. So if anybody's having family that's coming to your house from different areas, I think it's very important to assess the risk of if there's anybody that's unvaccinated, if anybody that is immunocompromised, you may consider not gathering. But a way of doing it is that also getting people tested, testing right before you come or that day of the event to ensure that nobody is asymptomatic and has the disease to spread it to others.
So the Delta variant, it's also still here. I know we're on to the Omicron variant, but it's still here. So what are the recommendations to keep risk low for COVID-19 going into holiday and the New Year's celebrations with that?
Yeah, so I'm glad you brought up the fact that, the Delta variant is still the majority, right? Right now, it's still like in the US, it's like 97% of cases that's being brought up, and a majority of that still in the hospitals that's causing severe disease. In general, it is so important to still continue with those 3 W's. Wearing a mask indoors is really important when you're going into places that you don't generally meet people, or if you're having new people in your group that's coming over, still mask if possible. And but the other aspects is that try to do as much as you can outdoors. If you're having a meal or sorts or activities, there are plenty of great I know it's getting cooler, but bundle up, and there's still like some great events that you can do outdoors. And if you're meeting indoors, making sure you have good ventilation, try to open up some windows. The key thing, though, is really reassessing everybody's risk. We're really worried that this is going to really come across North Carolina very quickly. And especially for folks who haven't had boosters or who are unvaccinated or immune compromised, that risk of getting hospitalized when you get it gets higher if if you're not vaccinated appropriately.
All right, so I know you touched on testing just a little bit before. We meet friends and family that we don't live with for the holidays. So what time frame should you get tested? And are we talking about like a home test or going to CVS to get a test or something like that?
Yeah, so that's a good point. So if you can have a quick turnaround on a test for a PCR test, that would be great. That's the ones that you would get like at a testing center or a CVS or Walgreens. However, it's important to try to get tested as close to the time that you're gathering, because that really tells you what's happening at that moment. I think those home kits are great thing to do. In fact, kind of just doing it that day of the event, that tells you what's happening. And then also, if people are still deciding to meet, consider testing like 2 days after the event, or 2 to 3 days after the event, just to ensure that you weren't exposed at a bigger gathering.
Okay. So all the COVID tests that people are getting now, I know that testing is on the rise. Do they check for the Omicron variant as well as the Delta variant?
So they just test for COVID in general, and we're lucky that the Omicron variant still is being detected with the current testing modality. There are certain labs that are able to differentiate if it's Omicron versus Delta, but for right now, it's just a general test.
Okay, so you may not know what strain you have depending on where you go to get your test.
Correct.
All right, and if you test positive after you meet with your friends and family for the holidays, should you quarantine after that?
Correct. So if, for instance, if the scenario happens that you just went to a holiday party and somebody says somebody's positive that just went to that party, everybody should stay home, right? All of the contacts from that and should get tested. If you're positive, you should isolate and stay home and wait out those 10 days. And if your symptoms get worse to the point where you need to go to the hospital, obviously, and seek medical care. But it's super important to let your contacts know so that they know to quarantine and get tested as well to see if they've contracted COVID or not.
Okay, and a lot of medical practices, they may be closed for the holidays. So are there options for care if you do get sick during the holidays and you think you might have COVID?
Yeah, so I bet a lot of the health systems have virtual visits available, and also remember there's testing sites everywhere. Like there's testing sites, there's the home kits, there's also testing that's available through like CVS or Walgreens. I would kind of keep and like looking at the various websites to see where the access will be, but there are likely access to getting virtual visits to assess you. And obviously if somebody is so short of breath, right, that, or obviously not doing well, that's the point where you would probably need to be seen in person at either the urgent care or the emergency room. But again, we don't want people showing up at the emergency room for testing. People who are ill, you need to go to that venue. But if you're looking for tests, I would look online in some of the resources that we have in the community.